Okay, so we finished mobilising the thoracic spine now, so I'm going to go back to the reflex mode.
I wasn't expecting it, it made me jump.
Sorry?
I wasn't expecting it, it made me jump. It didn't hurt, it made me jump.
So we'll loosen everything off with the reflex mode. And then again, we'll go down to the spasm mode just to relax everything off a little bit more. Compressor kicking in again. So that's basically the thoracic spine treated now. We're going to go down to the lumbar spine. So we'll go back onto the reflex mode, onto the lumbar spine. And obviously now the left side of the spine is a tighter area down here, which is the opposite to the thoracic. So then we're going to go on to mobilise. We'll start here, mobilise mode, and then off we go again. So now the pressure is going to be focused on the left side of the spine to de-rotate that.
Because I have reverse S scoliosis, don't I?
You have the normal, the most common scoliosis.
Is that the reverse S?
Isn't it? Yes, it is. People have different names for it.
So what other names would that be? The only one I know is reverse S.
Yeah, a lot of people don't even call it that though. They just call it scoliosis, which is an S-shaped spine, whether it's reverse or normal S.
Okay, because there's C curves as well, aren't there?
There are C curves, yeah. So that's cervical curves, neck curves, of which I have treated a young lady for that, and that was very successful.
And there's kyphosis as well, isn't there? Which is when it hunches over.
There's kyphosis and there's lordosis. So lordosis is when the lower back arches too much, and kyphosis is when the thoracic spine kind of curves forwards. So you can get patients with a combination of all three: scoliosis, kyphosis, lordosis, which is unfortunate. Most scoliosis patients do have some kyphosis.
And I have.
You definitely have.
It's improved a lot though, hasn't it?
Yes, it's better.
I mean, how much kyphosis would you say? How much would you say that kyphosis has improved?
Oh, I would say that's probably improved about 60%.
Which is very good.
Yeah.
Because I've met people that think they're too old for this. And I know Damien said he could treat very elderly people.
You can treat elderly people. You just adjust the treatment, the pressure. But yes, you can treat anybody with this.
And that includes children with brittle bones, doesn't it? I believe Damien treated a child with brittle bones.
Yeah, again, one would have to be super careful with that, but it can be done, yes.
He did put a video up with ASMI for a delicate spine.
Yeah.
And that would be me. He was showing them on me because at the time my spine was very delicate.
Yeah. So you've come an awful long way now because you're accepting a good deal of treatment now.
Yeah.
Which is amazing.
I have to give a lot of credit to Damien because he treated me for the first year as well.
Yeah.
Damien was a wonderful man, sadly now deceased, but his patients all remember him very kindly.
They certainly do. He was he was quite an eccentric, was Damien, but he was a lovely man, and his pure focus was to help people with scoliosis, and he would do anything in his power to do that.
There was an absolute passion with him, wasn't it?
It was.
Also, his passion was to get it into hospitals.
Yes.
Which is what we'd like to do.
And you're doing a stunning job now.
Thank you.
Of promoting it, hence why we're doing the video today.
Yeah.
So.
Our local hospital, there's Stoke Mandeville, which is interesting.
Spinal unit, yeah. So they've shown an interest, haven't they, Loretta?
Well, only one or two people that work there. I don't know whether the big boys have seen anything to do with it. I doubt it.
Well, you never know.
But I do want to send off my before and after photos to see if they might be interested. Because it seems sad that something that is famed for its spinal treatments doesn't have ASMI.
Yeah. And I believe the consultant was blown away with the results of non-surgical treatment.
No, yeah, I don't know whether she was a consultant or not. She might have been the radiographer.
Okay.
But my doctor certainly, I think she was sceptical to start with, but sometime later she put on her notes, ASMI prescription, huge benefit.
Yeah.
And she said she can definitely see a big improvement.
And that's all we want.
I also noticed that some of the problems I initially had, because I knew it was getting worse and I knew I had to do something about it. And I did a lot of research and I prayed a lot, so I didn't waste money on snake oil. And I was sceptical about ASMI as well, but there seemed to be so many people that I could find that had seen improvements that I thought I will try it and see what I think. And after the very first session, 2 problems that had just appeared in the last couple of years before that vanished. I've never had them again.
And how many sessions did you have with Damien?
I think I had something between 11 and 16. I'm not sure. I've lost track now.
Okay.
It's all on my before and after photos. If you look those up online, you'll find them on Facebook. On what's the name of Facebook group, Tina?
Scoliosis Cures and Pain.
Relief. Scoliosis Cures and Pain Relief, I think.
Yeah.
And you'll be able to see my before and after photos there. And I'll be putting new ones up after this session.
Yeah, we'll take our photograph and we know it's going to be some improvement in there. But you have a long way to travel as well, Loretta, to get to me here.
Yeah, we live in the Chilterns. We have a 2.5 hour drive to get here. So we stay over for a few days to get a couple of sessions in, because I also have MA. So I need to rest after sessions. That's it.
Yeah, just sit a little bit.
Are you still filming, Ian?
I've just